Good to have you with us. Scott Johnson joining us now. Scott Johnson is a longtime lawyer in the Richmond area. He is also an associate general counsel as a seasoned expert in governmental affairs. Scott Johnson has lobbied for his clients on the front line of health care legislation for a quarter century. He's got a steadfast presence at the Virginia General Assembly and has earned him the recognition and respect of an ever-changing roster of influential government officials in the General Assembly. And he's with us now to talk about a bill that I'm very excited about. Hey, Scott, good to have you with us.
Thank you, John. Good morning.
Scott, I want to talk about a bill which my good friend Lee Ware has up. Anybody who doesn't know this, Lee Ware, Republican House of Delegates member, also a committee chairman from the West Richmond, Couchland area. And it has to do with not getting screwed on your medical bills when you have an emergency. Scott, I think you're better versed in explaining this than I am in layman's terms. Can you give us a overview of Lee's bill?
Sure, be glad to. So the bill you're talking about is House Bill 1714. And what this bill does is addresses a situation when a patient goes in to an emergency room and they receive treatment. Sometimes the physicians providing the treatment, whether it's an emergency room doctor or orthopedic surgeon who's called into the emergency room, may not be in that patient's network, or sometimes the emergency room itself may not be in the patient's network. And what physicians and hospitals all agree on and want to do is we want to eliminate or stop the situation where the patient subsequently receives a bill and realizes that the physician or the hospital is out of network. So a ban on balance billing, if you will. Now, with that comes some other protections that have to be in place, and that is, well, if you're not able to balance bill the patient for the difference between what the insurance company paid and did not pay, how is that payment going to be reconciled, and how is that going to be determined? Current law basically says that Virginia allows balance billing as it's permitted on the federal level. And if you're allowed to balance bill, current law says what that out-of-network doctor or hospital gets is the higher of three things. The higher of the in-network rate with the insurance company, the higher of the usual and customary charges or reimbursements from the insurance company, or what Medicare pays. And 9 times out of 10, the highest of those three is going to be the in-network rate of the insurance company. And if that was such a good number, you would have seen the physician group or the hospital accept it and become in-network, because clearly the preferable thing is for physicians and hospitals to be in-network. But again, that's going to be determined based upon if they're getting paid a fair and reasonable amount. So if Virginia passes this bill and prohibits balance billing, then they have to address what is going to be the fair payment for that out-of-network provider. And that's what the General Assembly will be debating this week. We think that the fair thing for the hospital side is a fair market value payment, where you look at what's fair in the market. And on the physician side, currently today, insurers have to report what their commercial payments are, so an average of those commercial payments. And the reason for that is if you don't address it that way, you have given tremendous power and leverage to the insurance companies to drive down in-network rates, knowing that that may force providers out of network and realize that they have no means to level the playing field. So that's really where the argument is and what the debate is going to be this week.
So, Scott, basically this occurs when a patient has insurance and they receive care from a healthcare provider who is not in-network insurer. And normally this is going to, because, look, if you have a procedure or something and you can plan it, well, what do? Well, you go to your book, you go to your online, you get your network provider, you go there. But sometimes you have an emergency, right? And if you have an emergency, you can't be fiddling around with who's open now, and you're going to go to wherever you can get the care the fastest, right? I mean, that's simple.
That's correct.
Everybody does that, right? So you have insurance, you're paying for it. You go to an out-of-network provider because you're in an emergency situation. You get your care, you go to the doctor, you get whatever the procedure is. God willing, everything is fine. Then, month later, you get a post-emergency shock, right, in the mail that says you owe these thousands of dollars because you went to an out-of-network provider in an emergency situation. So what the Ware bill does is it's called balance billing, right? So just walk us through again, because this is a common thing for everyday people, right? Something goes down, you can't manage through the network providers. You have to get emergency care immediately. Then you get this humongous bill in the mail, and you're like, what the hell is this? You can't pay it, right? So how does what does the balance billing initiative of Ware exactly, how does it solve this in layman's terms?
Yeah, if this bill passes, it will end the balance billing practice, or what some people call surprise bill in the mail, because oftentimes a patient unfortunately does not realize that the ER physician group or the anesthesiologist that got called into the emergency room, any doctor that cared for you, they may not realize they're not in your network. So if the doctor was in your network, the insurance company would make a payment to that doctor, and what the patient owes is what they call cost sharing, meaning your copay, your deductible, or any coinsurance. But if that doctor or hospital is not in your network, then there is going to be a situation where your insurance company will make a payment, but that payment won't be sufficient to cover the bill. And so today what that patient is receiving is the difference between what the doctor charged and what the insurance company paid. If Delegate Ware's bill passes this week, what will happen is you will not get a bill for that difference. So you're seen by an out-of-network provider. That provider is going to get paid an amount by the insurance company, and the only thing that you will owe is the same thing you would owe today, meaning your copay, your deductible, or your coinsurance.
All right, so Scott Johnson, what you're saying is if this bill passes, a patient that went to get an emergency procedure out-of-network will not be required to pay an out-of-network provider over what their typical payment would be if it was in network, and so it would be the same no matter what, right?
Correct.
So, okay. So then you ask the question, if you go to an out-of-network provider, which is not the rules of whatever insurance, of some insurance companies you have. I don't have that because I'm with a share company. I can go wherever I want. By the way, if you need insurance, libertyhealthshare.org. Let me throw in that plug. So, Scott, what's to say that I go to an out-of-network provider and it's not really an emergency? I just want to go to somebody else, and then I say it is an emergency. How is that determined?
So it is not addressed in Delegate Ware's bill that we've been talking about, but he has another piece of legislation that will address it. And let me use as an example that you have gotten to the point where you need to have a total knee replacement. It's not an emergency, but you're making planning for that. And there's other legislation being looked at that when you are going to have a total knee replacement and you've picked your orthopedic surgeon and you've picked your hospital, when you go to the hospital for pre-registration or your pre-admission work, the idea would be that you would be provided with a list of the hospital groups there that have exclusive services like radiology, anesthesiology, pathology, things like that you may need as part of having your total knee done. So you then can take those names to your insurance carrier to say, are these groups in my network? And if they are, great. If they are not, then you've got time and opportunity to make some choices. You may choose to go to a different facility to have your total knee done, or you may make the decision, I really want to go there, and I understand that I may have to pay extra for a particular service if it's provided out of network. So it's more transparency, more patient information, more thorough decision-making is what's intended with that.
I've got a question from Jeremy in Chesapeake who says, is the bill retroactive?
So the answer to that is no. The bill would be effective, as most of our legislation is, on July 1, 2019. So it would apply to any care delivered after that date.
So who would pick up the cost? So normally if you have insurance and you go to an out-of-network provider, you get the bill because they don't want to pay they say, well, you're out of network and we're just not going to pay it. So you get the surprise bill. So where does that money come from?
So if you ban balance billing, then obviously the patient is not paying that money, and it has been the patient who's been paying it today. And that is the real debate in question this week for the General Assembly is, okay, balance billing in reality for a healthcare provider represents a pay cut. What can we do on the reimbursement side from the insurance carrier to make up that or keep the playing field level? And what we've been advocating for to say if the facility's out of network, it should be a fair market value rule of the road, new rule of the road, or if it's a healthcare provider or professional, it should be an average regional commercial payment, meaning an average of what the commercial insurers are paying in this geographic area for the type of service that that patient received. And that data is already collected and it's available and it's known. We don't want to do anything to incentivize providers to leave the network, but at the same time, we can't leave status quo as to the payment amount because that will too heavily favor the insurance companies and the ability to fairly negotiate is going to be shot.
Wow. Scott Johnson, let me ask you something. Who on earth would be opposed to this bill? I mean, what person would stand up and say, no, I want to keep screwing patients in Virginia, let them pay more because they were forced to have an emergency? Who on earth would be opposed to this?
Well, that's the thing. Nobody that I know of is opposed to the prohibition on balanced billing. Healthcare providers are united on that we want to get patients out of the middle of it. We're there to provide health care, not argue over bills. Where the differences lie is what's going to be the new payment amounts that are going to be made by the insurance companies for these out-of-network services. And that's where the argument is. So it's a very important but crucial issue because if that's not done right by the General Assembly, you have really turned healthcare on its ear when it comes to the financing and it comes to negotiations with insurance companies. And we don't want that. We want good access to health care. We want adequate health care networks for Virginians, and that's really what we're working the hardest on.
And the only significant opposition to it that I can find comes in the form of another bill by House of Delegates member Kathy Byron of Campbell County, which is backed by the big mammoth insurance companies that gives insurance more leverage in just how the billing goes. So that's exactly what you said. I'm opposed to that. Anything that big insurance companies are in favor of, I'm opposed to it. I like Ware's bill, balanced billing prohibition of balanced billing. Scott Johnson, great analysis, man. Great analysis. Thank you.
Thank you, John. And one thing I will add, the patient groups are supportive of Delegate Ware's bill, too. So it ought to tell you something. When the patients and the healthcare providers are on the same team, pulling the same way, rowing with the same oar, that's a powerful message. Especially
when the big mammoth insurance companies are opposed to it. Biggest no-brainer in history. Thank you, Scott Johnson.